A major expansion is coming to WVU Medicine Camden Clark, adding beds, private rooms, and a redesigned women's and children's floor. Our Cassidy Fury shows how hospital leaders say it could improve care and create new jobs.
Leaders of WVU Medicine Camden Clark say this new tower is about more than new space. It's about meeting growing needs in Parkersburg and improving the patient experience from start to finish.
Even though WVU Medicine is not headquartered in Parkersburg, it's important to recognize that they are putting the resources back into the communities in which we serve.
According to hospital president and CEO Sean Smith, the $135 million project expands overall bed capacity, aimed at helping patient flow throughout the hospital and easing bottlenecks when the ER is full.
So that allows us to be able to get patients through our ER quicker who are going to be admitted. That frees up capacity and throughput for treated and released in the ER, as well as those that are being admitted. And it helps us to be able to look at the acute care and the throughput in that area as well.
A big change patients will notice: more private rooms, something Smith said is both a preference and a practical improvement for care.
It is one of the number one preferences of patients. I mean, it's counterintuitive to put patients who are sick into the same room together. And so it allows us to be able to respond to the patient's desires, but also responds to the patient's need.
Families could also see a different experience on the women's and children's floor, with a model designed to keep more of the processes in one place.
We'll have labor, delivery, recovery, and postpartum all in one room. We'll also have 2 C-section rooms that service that department and that floor. And so everything in that unit will be self-contained.
And with the hospital seeing a high volume of patients, Smith said parking has become a real pinch point, something this project is also designed to address.
Our parking does become a little bit restricted, and so we are going to use this project to be able to expand parking by 450 spaces. And so we also look at the convenience for patients and families, and so this will allow them more space to be able to park closer to our facility as well, which is important to us.
Along with patient care upgrades, the hospital expects the expansion to bring new positions, estimating dozens of additional jobs. Smith said construction is expected to finish in March of 2029, with occupancy planned for May of 2029. In Parkersburg, I'm Cassidy Fury with WTAP News.